Welcome to another episode of I Wonder, Doctor.
I'd like to talk about the proper way to take melatonin. Not too little and not too much.
Well, I sure understand the not too little part, that's obvious. But you're saying that there's too much as well.
There is, and let me back you up a little bit.
Yeah.
I mean, daytime's all about activating hormones and neurotransmitters.
Yeah.
And nighttime, this brand new hormone comes in, the sleeper, melatonin.
Yeah.
And supplementing it can be good for those who are not producing enough, and that can take place. And you can measure melatonin, as I've done many times,
Yeah.
yet there's a simple and cost-effective way to just explore taking melatonin.
Yeah.
Try it out, because melatonin is so safe, it's so good for you. It's the brain's premier antioxidant, quenching free radicals that are produced in brain metabolism.
Yeah.
It helps the immune system. It's even cancer preventive. So melatonin is so good, I always feel warm and fuzzy about it.
Yeah.
I'd like to talk about dosing. It's a special phenomenon in which I teach my patients how to find their optimal dose, because they're the ones who can feel this.
Yeah.
And melatonin is strong enough that you can feel it. You can't do that with penicillin. You can't feel it, but you can with melatonin.
Got it.
So let me give you an example here. This is the first night, and I start people on a 0.5 milligram.
A 0.5 milligram.
I do.
In the store, I see like 1 milligram, 3 milligram, 5 milligram.
Which is often way too much for people.
Yeah.
I mean, my optimal dose is 1.5 milligrams, and I'm a pretty big guy.
Yeah.
So I start people on a 0.5 milligram, and then the next morning when they wake up, I'm asked them to evaluate it. Like, how did you feel? Did you sleep any better?
Right.
And if they don't notice it at all, I have them increase to 1 milligram that night.
Yeah.
And then the following morning, people evaluate it. And if they notice, oh, I slept a little better, okay, well, you know we're getting there. That night, I have them increase to 1.5 milligrams, and then the next morning when they evaluate it, let's say they go, wow, I even slept better.
Yeah.
The next night, I still have them increase to 2 milligrams. And let's say the next morning they wake up and they go, wow, I feel a little groggy. This stuff didn't work as well. We have them back down the dose to 1.5 milligrams.
So for that particular patient, they found their dose, and it happened to be 1.5 milligrams.
That's right.
Yeah.
And of course, there's variations that could take place there. Some people may need more, some people may need less.
Yeah.
The phenomenon is called the pharmacological window,
Okay.
in which too little fell shy of the pharmacological window,
Yeah.
and too much overshot it.
Yeah.
You want to get right within the pharmacological window. That's called right dose.
Okay, let me see if I understand this. So my very first night, no matter how big a guy I am, I start at 0.5 milligram.
That's right.
Okay. And if I wake up and I didn't sleep as well as I wanted, that night I then go to 1 milligram.
Exactly.
Same thing. If I still want to sleep better, I go to 1.5.
That's right.
And then the night after that, I go to 2.
That's right.
And I just keep increasing until, one morning I wake up and I feel groggy.
That's
or maybe
right.
it didn't work as well as it had been working.
Precisely.
Now I know I've exceeded and I back down a little bit.
And that's how you do it.
Okay.
Now, there are some sensitives
Yeah.
that even 0.5 milligram is going to be too much. And we know this when we test serum levels. You get people into 1, 1.5, 2 milligrams. Sometimes they're getting higher blood levels of melatonin than they would ever have under natural circumstances.
Yeah.
So some people, we start with a liquid form to be able to get the dose even lower than 0.5 milligram, have them put it sublingual, that's rapid acting.
Yeah.
There's long acting forms. It's not hard to find your right dose with melatonin.
Okay, so I found my right dose, whatever number it is. That's it. Do I take it every night now, forever?
Well, good question. It depends. Some people have transient, stressful times of their life, and they need a little help sleeping.
Yeah.
And so they only take it for as long as they need it. And sometimes, interestingly enough, in those situations, a patient will report to me that, God, I start forgetting to take my melatonin. Well, they don't have trouble forgetting it if they're having trouble sleeping. They'll remember it.
Right.
Serendipitous, they forgot it. Other people, who have been insomnia for 5 years and they benefit by melatonin, hey, listen, take it for the rest of your life. It's got so many other good effects. I feel, unlike a lot of substances, I feel so warm and fuzzy about melatonin. And should you take breaks from time to time? Yeah, especially in transient circumstances, because you don't want to be taking too much and then suppress your own pineal gland ability to produce hormones, because that's how the body will do it. If it registers too much, it's going to suppress the glandular activity.
So every month I should take, a couple days off?
Yeah, definitely.
Okay, great. Thanks.